Hello, everyone. This is Jessica Davis, Senior Editor for SC Media, and I'm pleased today to be speaking with Darren Lacey, the CISO for Johns Hopkins Medicine, as part of our special Cybersecurity Awareness Month coverage. Welcome, Darren. Thank you for joining me. It's great to speak with you again.
It's good to be here. Looking forward to it.
Right. Well, so I think that, we're all aware that the approach to cybersecurity and healthcare comes with a host of unique challenges, from the staggering number of endpoints to heavy reliance on third-party vendors. I'm hoping that you can discuss from your perspective what's behind some of healthcare's struggles with bolstering security.
I think the main thing in healthcare is the thing that's been there forever, which is that there is not a single unitary business process called healthcare. Every subdiscipline has its own challenges. One of the reasons there aren't very many electronic health record companies in the United States of any size is because it's very hard to actually meet all the workflows of a typical complex clinical environment, whether it's outpatient or inpatient. So if you have complex environments and complex workflows, you're going to have security issues. When you have mountains of data, you're going to have security issues. This is not, there's really nothing special about healthcare in that regard. It's just that we have more of everything. We're the biggest sector of the economy. We have more complicated business processes in fairly tight places with fairly low budgets than almost anyone. So the idea that healthcare is anything other than just the aggregation of workflows and data, I think is a little bit sensationalist.
No, I would agree with that too. And I think that, there is that sort of idea that, there are these staggering amounts of, this or that, and that we're a unique place in terms of threats, but it seems to be sort of more that everyone is challenged right now, especially as we've seen with some of these massive supply chain attacks. The effectiveness of threats are getting increasingly alarming as well. I think when we spoke last, a few years ago, I don't know if you could have fathomed as well, sort of the infrastructure organizations are really facing some highly intelligent threats. Are you seeing that as well on your end? Has it increased that exponentially, or rather that the threats are just becoming more targeted, smarter?
Well, I think the main thing is they're just more in volume.
Right.
I think you can start with there are more vulnerabilities now identified. Right. Now that's a good thing. More eyes are looking at it, so we're patching more. But it also demonstrates that there's more ways to attack. You're right. The adversaries have figured out there are ways to scale attacks across multiple organizations, and we call a lot of those attacks supply chain attacks, like SolarWinds and those types of things. And that's actually produced new challenges. But ultimately, even supply chain attacks typically involve some kinds of choices, some kinds of configurations by the essentially end organization. So even you can't just say it's a supply chain attack. It is just in the same way that if they attack a Windows, an HP, if there's an HP on your environment that's running Windows and has a vulnerability, you can't say that, well, obviously this is an HP problem or a Microsoft problem. What you can say instead is you can say, well, this is a problem that we need to configure, we need to monitor, we need to use security, recognizing that they're likely to attack technologically something that we didn't make, in our IT shop in the back somewhere, that they're attacking something that they know about, and they attack that, and our job is to configure it and monitor it properly.
Right. Well, which is great, if you have that sort of team behind you as well. And I know that, for a large hospital, those resources are definitely, I think, a bit more established than sort of smaller providers. So you may have a good sense of sort of, how then, I guess the idea is sort of with both the struggles and the sheer professionalism for threats, what are you seeing as sort of the biggest concerns facing your environment? And then how do you pare down some of those items in that landscape to sort of approach threat mitigation?
Well, I mean, to start off with, I mean, yes, every organization has a sort of different mission. If you have a large, diverse healthcare delivery organization, um, you're going to basically allocate resources differently than you would be if you're a small shop. So a small shop is going to say, look, I can't stop. I can't. It's difficult to stop sophisticated attacks. So I'm going to assume that my risk, my attack surface is relatively small. And I'm going to basically focus on the main things. So I'm going to focus on segmentation. I'm going to focus on endpoint detection and response, and say, admin multi-factor auth and multi-factor auth for remote access. I'm just going to focus on those. That's where I'm going to work. That's where I'm going to work from. That's a sensible strategy for a small organization. For larger organizations, we have to look for more black sheep, and black swans, sorry, and black sheep too, but black swans in this case, where we're basically looking for rare attacks. So you have to build in layers, defense in depth, and layers of controls underneath that. So it's a different call. It's a different call in terms of technical sophistication. Your staffing is different. So a person who works well in one environment may not work well in another environment because essentially of the level of sophistication of what the larger organizations are trying to get. The problem that one of the reasons the United States is, I think, in the world largely is struggling with cybersecurity is we haven't really figured that part out yet. It's a relatively new discipline. We haven't figured out how sophistication scales up with size and complexity. Sophistication of your tools, sophistication of your interfaces, and sophistication of your staff. And it's just not. I mean, it's just not something we've worked out yet, and it'll take a while. In the same way that basically writing, and it may change how we think about things. I mean, if you imagine, 25 years ago, people, I mean, Linus Torvalds wrote Linux, the first version of Linux, kind of by himself. Then he brought in more people. But now, basically, Linux is run by many, many people because it's such a complex piece of software. And so everybody takes a little piece of it, what Eric Raymond called the cathedral. Everybody takes a little piece of it. And that's going to happen in cybersecurity, where in large organizations, everybody's going to get a little piece and have to specialize. And we haven't figured out how that specialization is going to work as organizations scale up and down.
That's an excellent point. And I think that sort of bodes into sort of some other ideologies I've heard, which is sort of, breaking down silos within the healthcare organization itself, sort of, between IT and security and between biomed and IT, so that we can all communicate better. And that sort of, I wonder as well, you mentioned defense in depth, but part of that key process is visibility, and how can you secure what you can't see. I would love to hear, since you're so big, how do you tackle those visibility challenges that sort of kind of contribute to, in other organizations, those long term hacks?
Yeah, I mean, right. The thing about it is that if you use a model where you kind of model yourself after what the attacker is likely to do,
Right.
and say it's an adversarial security program of sorts. The first thing, when you bring in a pen tester, the first thing they typically do is they run a bunch of discovery tools. So discovery, it sounds easy, but is ridiculously complicated. Because it wants to be dynamic. You want to be able to profile things, essentially signatures. And yeah, if every device is made by the same person and managed by the same person, then that's no problem. But most healthcare organizations, that's not the case. Your HVAC system is different than your medical devices, which are different than your workstations, which are different than people logging in from home.
Right.
different clinics and those types of things. So just discovering and profiling is difficult. And
Mm,
and the tools that we have, the vendor tools, almost all have to be augmented
mm,
by essentially data analysis, maybe maybe writing to multiple interfaces. It's a super difficult problem. It
right.
is a neglected problem in terms of, because we all want to get to defense, but it is, you know, one of the core issues. And so when you look at an organization, you can say, okay, your discovery problem goes up essentially, exponentially is too strong. It goes up by a factor quicker than the size.
Right.
And so I personally, in my practice, I spend a lot of time working on discovery tools and discovery techniques, but I still haven't figured it out. And I think this is just one of the areas where it it's actually kind of interesting in the sense that you talked about the relationship between IT and security.
Right.
Discovery is an area where it's good for both. So
Mm,
if your IT, if your security people are good at discovery, they can write tools that are useful for IT and operational contexts,
right.
or vice versa. Typically, though, it starts with your security people, because it's rare that you have people who can, as their main job description, oh, I go and find things, is not typically what people do when they're doing operations. But in security, we do that all the time. We say, your job is to find things. That's what you do.
Right.
You wake up, you go in the morning, you find things, you get them, you know, where they present properly, go get them. And it doesn't take that much long to scale that over to other valuable operations that people typically don't think about.
Right.
And that's why I do think that we in security are kind of leaders in some respects in IT, because we fill those weird analytic crevices that
Right.
IT, which is so operationally focused, doesn't actually, let's say, adequately fill.
That that's an excellent point. I appreciate you breaking it down like that. I do think though, if it is one of those challenges that is kind of not impossible, but I mean, it's going to be a while. How then, if you can't see everything, do you ensure that it's one exploit isn't leading to a massive one? How do you reduce that landscape, I guess?
Well, we don't see atoms, but we see the effects from atoms. I mean, you know, there are behavioral, reverberations that are typical of things malfunctioning or perhaps under attack. So there is a discovery and profiling component piece, and then there's a sort of continuous monitoring piece. And even though you're peering through the glass darkly, you can see things that you probably didn't see in stasis. And that's fine. I mean, you know, organizations do that all the time. It's entirely appropriate. What you try to do is you try to close some of those gaps between, you know, the effect of the thing and the thing itself. But ultimately, you know, you never completely close it, but you can't. Nobody I've ever heard of has ever started a program saying, until I know everything about everything, I'm not going to do anything in terms of monitoring because I won't know what it is. Everybody goes, well, I know some things, and I also need to monitor so I can learn more things. And there's always this sort of imperfect marriage between the two. And as you get better at it, you know more things, you know, in vitro, and you know more things as they, you know, bounce off each other.
Well, that makes a lot of sense. Um, so, and I do know too that I think part of what makes healthcare successful ones, security programs, is that idea that sort of patient trust and safety is sort of pinnacle. And I think part of that is making it a part of your mission. And I know that, Johns Hopkins is one of the leaders in that space, and I think a lot of that has to do with you as well. So I'm wondering, sort of, as a way to sort of communicate how to do this for other organizations that may be struggling on that transparency part, how do you approach security so that it's not seen as a burden or an obstacle within the organization, but rather a core, a principle of that culture, and sort of how is that, how are you then able to communicate it to the board so that it becomes like this, universal mission?
So, okay, so there's a lot there. Well, I'll say first, having a safety orientation, which almost everybody does now in healthcare. I think this has been one of the major changes of the last 20 years,
Mm.
is the orientation towards safety and the continuous monitoring and being able to pull the cord if there's unsafe processes. That culture is, as you said, is corresponds to what we're trying to do in cybersecurity.
Right.
So you don't have to translate across cultures. We know that we all serve a higher purpose, and that we're trying to do something quite difficult, which is deliver healthcare appropriately and safely in complex environments.
Right.
So people are automatically tuned into that. The concept of continuous monitoring, people are automatically tuned into that. People are tuned into the idea of processes, of checklists and those types of things as they go through their work. In fact, I think that most healthcare organizations are better attuned to that than most IT people. They have more to teach us than we have to teach them.
Right.
So it makes it easier. I've never found it that to be a particular challenge to try to characterize things thusly. Of course, we're going to get in the way in security, because what our job is to try to make things standardized. And sometimes innovation means you do things unstandardized, so you just deal with that risk as it comes along. But ultimately, when ultimately everybody understands that trusted systems doing useful, beneficial, and predictable work are what makes healthcare successful, and it's what makes cybersecurity more successful than it would be otherwise.
That's true. But I guess my only thought in that is that, it's not as frequent, but it is, it's pretty sensational when we hear, that a hospital's been down for a month or several weeks. And even despite those risks, I do think that there are some providers that, although awareness is there, they still are struggling with those implementations. Are there better ways that we could communicate or support other providers and better understanding that that sort of return on investment means that, you're less likely to, have months of downtime? Are there better ways that we can support them to understand it?
Yes, there are better ways.
Yes.
But I mean, a lot of this is that we, as a, I mean, we're in an interesting business in that we deal with labor shortages that are pretty remarkable. And there's a doctor shortage, there's a nurse shortage, there's a tech shortage. Certainly with COVID, I'm going to go a little bit off the reservation here and say that the COVID crisis may have staffing reverberations in healthcare for the next 20 years. The level of burnout, the level of, the burden that we placed on healthcare providers, not people like me who do cybersecurity, but the people actually treating patients, has been remarkable and sustained over a year and a half and for a period in the future. So we will probably have even greater shortages than we have now. So we have a major personnel shortage problem in healthcare, and we have a major personnel shortage in cybersecurity for wildly different reasons. I'm not exactly sure why. I think we could have 4 other discussions on that. So clearly, we don't have enough people in both sides. We don't have, and in cyber, we don't have a clear concept of what those people are supposed to be doing.
Right.
It's a new discipline. We haven't been doing this that long, and certainly the threat landscape as it's currently constituted is less than 10 years old.
Right.
So if you were doing this and quit 10 years ago, you have nothing to say to the rest of us. It's it's one of those things that we have to do the best we can, but ultimately we're running up against essentially the edges of human capability. and typically organizations that, suffer very damaging cyber attacks, it's a matter of, well, they didn't do a few things right, but then also they had some very bad luck.
Right.
And it is in some respects if not a black swan event, at least a dark gray event.
Right.
We're all struggling. We're all trying to figure out how to deal with this. But it's on. It isn't something where there's not a morality play in here.
Mm.
Whereas if everybody just got together and was more mindful of cybersecurity, we could solve this problem. If everybody just spent a little more time looking at, attachments, and then we would solve this cybersecurity problem. I'm like, no, that's never worked.
No.
And so we have to, we have to mature, we have to get better, and we will.
Right.
Whether we get better at the same speed, at a speed that it moves as quickly as the threat does, I don't know. But
Right.
we do have to get better. We do have to mature as a business, and we're operating in an industry that's going to face severe challenges in the next few years.
Um, I don't know if that's like the best place that we could end this, because it's definitely a little bleak. But I don't even know if, after, as you've mentioned, the year and a half that you guys have had, like, if there is a way that we can end it on a positive note. I know that when I was speaking with MITRE just a few weeks ago, their real concern is patient safety and, making sure that providers better understand how to get back online after an attack. Is that, at least from what you're seeing, is that even feasible in an environment where everyone's sort of kind of tapped out already on everything else?
I think a crisis tends to, an immediate crisis tends to focus everyone's mind. Even in
Yeah.
COVID, they're not going to go, well, we can't basically bring our systems back up because COVID's been bumming us out for 18, 19 months. No, you're still going to do that. You're still going to focus on these types of things. I was really just talking about deeper seated issues in our field that we've always been worried about the nursing shortage. We've always been worried about especially the general practitioner shortage in our field. And when I say our field, I mean everybody, because everybody needs a nurse and everybody needs a doctor, and we should all be worried, not just those of us who get paychecks from healthcare or delivery organizations, but all of us should be worried about this. And cyber is a component piece of that. And I would say to people who do cybersecurity that getting into healthcare is a higher calling.
Yeah.
It is, at some point you're going to need it. You may not need it now, but at some point you're going to need it, and you're going to be glad. You're going to feel better about yourself and your practice if you get into our field and help us all out, because we all need the help.
I think that's a great place to end it, Darren. I really appreciate you taking the time today. This has been a great conversation, as always.
Thank you, Jessica.
Thank you, Darren. Have a good rest of the day, I guess. Yeah, and we'll be in touch. Thank you.
You too.